is deceptive. It is not always that a healthy person is sexually healthy. People get married and then want to have children. But when they cannot have children, their relationship becomes one devoid of happiness. Not being able to have children is due to infertility. Infertility is the inability to conceive and become pregnant after 12 months of regular unprotected sex at the time of ovulation.
I came to know about Dr. Rohit through Dr. TB Singh. He told me that you can, in Calcutta, Neotia is having Dr. Rohit. He's a good doctor. You can go to him. Just have an idea, because I was planning to go for an IVF to Mumbai. So he told me just go and meet him. I think you'll feel confident and you can have your IVF done with him also. So I went there. I had a talk with him. I felt confident with him working. So things worked out and we went ahead.
In vitro fertilization or test tube baby involves removing ovum or egg from a woman, fertilizing it with sperm in the laboratory, and then transferring the fertilized ovum or the embryo into the uterus after a few days. If a woman does not conceive after a year of effort, it is likely that the man, the woman, or both the parties are infertile. For the infertile couple, the IVF has given a ray of hope. The first human test tube baby, Lucy Brown, was born on July 25, 1978, in England under Dr. Steptoe and Edwards. In India, the first and the world's second test tube baby, Durga, was born in October 1978 at Kolkata under Dr. Subhash Mukhopadhyay. Infertility is due to a number of reasons, such as stress, smoking, substance abuse, alcohol, malnutrition, obesity, bicycling, sexual issues, genetic factors, physical abnormality, and so on.
My problem is endometriosis, and actually I had cyst. So they've removed the cyst, and the fallopian tubes, they are they're damaged. So that is the reason I could not conceive naturally.
What I felt, none of the doctors whom I went in my 10 years or 11 years of period, nobody has clarified it. But what we felt, according to our knowledge, whatever we had, was that fertilization was the main problem. And this problem is easily solved with IVF.
Actually, there is, unexplained infertility case nowadays.
In India, as like any other country, infertility is affecting around 15% of the couples who are trying to get pregnant. In my practice, what we see is that if 50 couples come to me in a month, around 15 of them suffer from male factor infertility. That is, the husband has poor quality semen, which is the reason for infertility. In the rest of the 35 couples that I am seeing, 50% would be women who have blocked tubes, and 50% would be somebody who has either crossed her age of pregnancy or egg quality is not good.
Initially, the IVF was developed to deal with the problem of the fallopian tube, but it turned out to be successful in many other infertility situations, like men with very poor semen quality and women not producing ova of their own. For IVF to be successful, it requires healthy ova, sperm that can fertilize, and a uterus which can maintain pregnancy.
The first time that a infertile couple comes to us, so we register the patient, and then that day itself we have a proper counseling class, as to say, so that we can explain whatever we do here and whatever goes on here, the kind of treatments we have and what she has to go through. All those we explain to the patient, basically counsel them about everything. And then from the second day of the lady's menstrual cycle, we usually start the procedure for the in vitro fertilization, or the test tube baby in common language.
The process of IVF involves 6 steps: administering stimulants to the woman to produce ova, taking out the ova or eggs, taking the man's semen, fertilizing the ovum outside the body, putting the embryo inside the uterus, and checking whether she's pregnant or not.
In an in vitro fertilization cycle, we want to develop as many as 10 to 12 eggs in the lady by giving her hormonal injections. These injections are started from a fixed period of a cycle, which could be the second or the third day of a menses. These injections are FSH or HMG injections, that is follicle stimulating hormone, or human menopausal gonadotropin injections, that are administered at the same time every day to help us develop more than one follicle in a naturally ovulating lady. This is known as controlled ovarian hyperstimulation. The purpose of doing this is to make as many eggs, good eggs, to grow up in a particular month. Along with giving these injections, the lady is also administered other injections to help ensure that she does not ovulate on her own. Third that is done is that when the lady starts forming these eggs, we do serial ultrasound of the lady to see if the eggs are growing nicely or not. Once the eggs reach a maturity size, that is around 18 millimeter follicular diameter, we are now sure that the lady has mature eggs. It is at this time that she is administered a final injection of human chorionic gonadotropin.
So a little bit tension is there, and injections are 15 to 20 or more than that, 50, I don't know, but a little bit tense. But then there is always a hope that after taking so much burden physically, mentally, financially, I will be successful.
After 35 hours of that HCG injection, we do the ovum pickup. So the ovum pickup takes place here in the operation theatre. It is done under general anesthesia.
Ovulation takes place about 36 hours after the final injection is administered. Retrieval procedure takes place just prior to that in order to recover the ova from the ovary. The patient is under anesthesia. This is the needle and this is the ultrasound probe. The ova are retrieved from the patient using a transvaginal technique involving an ultrasound-guided needle piercing the vaginal walls to reach the ovaries.
I've entered the follicle, now I'm aspirating it, so the follicle will slowly collapse.
This is the follicle. It is aspirated and collected in this tube. This follicular fluid is handed to the IVF laboratory to identify the ova. The follicles are aspirated from both right and left ovaries. The retrieval procedure takes about 10 to 20 minutes.
No, actually, I had complete knowledge about the IVF cycle. What the doctors will be doing, and how is it done, and I haven't experienced any problem.
In the laboratory, the follicles are taken to the laminar air flow, where the temperature is maintained at 37 degrees Celsius. They are analyzed under microscope to identify the oocytes or ova. This is an ovum. The ovum is kept in this petri dish. It contains the media which was in the ovary. In the case of this patient, it has 3 ova. The ova are kept in the incubator. The temperature is maintained at 37 degrees Celsius, which is just equal to that of our body or of the uterus.
At the same time, the husband or the partner of the lady is asked to give a semen ejaculate that is also taken in the laboratory. The seminal plasma, prostaglandins and the occasional pus cells are eliminated through a process of sperm wash technique, where we centrifuge the semen sample and remove the dead sperms, and thus we have both the male and the female gametes in the laboratory.
This works on the principle of centrifugal force. So like the lighter particles will come up and the heavier particles will move down. So like you will get the motile sperms towards the up and the non-motile sperms towards the lower part. So what happens is we don't want to inseminate with the non-motile sperm because that's going to harm actually, because more number of non-motile sperms will actually is not good for the oocyte environment. So that's why we want only the motile sperms. So after the centrifugation is done, we'll keep it in the incubator for swim up. So only the motile sperms are able to swim. So just they'll swim up and we'll take the count, and the non-motile sperms will be below.
On an average, 50 to 60 thousands of good sperms are put together to fertilize an egg. Now the petri dish is kept in the incubator. After 14 to 18 hours, one of the sperm penetrates the zona of the ovum and gets fertilized. In a situation when the sperm count is very low or difficult to penetrate the ovum, a donor sperm may be used, or a single sperm may be injected directly into the ovum using Intracytoplasmic Sperm Injection or ICSI. This is a machine that does the job.
This is called micromanipulation. This is a very advanced technique in infertility. And here the embryologist is the person who is choosing the sperm, who is penetrating the sperm into the oocyte. See, this is a oocyte. You can see this is a oocyte. This is the holding pipette. With the help of this pipette, the oocyte has been held. This is the injection pipette. See, and this is the sperm. See. Now I will inject the sperm inside the cytoplasm. See, the sperm is here, right? The sperm is here. This is called the intracytoplasmic sperm injection, where we are manually injecting the sperm into the oocyte. and then the next day we are checking for the fertilization. The rest of the procedure is just same like IVF.
The growth of an embryo is properly monitored. It has to be made sure that the temperature in the incubator is constantly checked.
And see, these are the embryos. At this stage we do the transfer. See, this is the 4 cell stage embryos. We call it 4 cell stage embryos or day 2 embryos. You can see there are 4 cells, 1, 2, 3, 4, and each of them cell is called blastomere. At this stage normally we do the transfer. This is another embryo of 3 cell stage. This is another embryo of 4 cell stage. Amongst them you can see a round thing which there is no cells. This is an unfertilized oocyte.
Once the embryo has grown to 4 to 8 cell level, the best embryo is implanted in the uterus with the help of a very thin plastic catheter on the 3rd day from the day of pickup.
In the whole procedure, there was nothing as such that it is very painful, or the only thing was that you have to take rest after IVF is done.
After putting back the embryo in the uterus, we give the lady medicines and advice to maintain her endometrial levels so that the embryo finds it easy to implant. 15 days after this, we generally do a hormonal test to find out if the embryo has implanted or not. Once the embryo has implanted successfully, we call her to come after another 15 days to see if the embryo has implanted within the uterine cavity and whether the embryo is growing nicely or not.
See, delivery within 6 months, the thing was that I was having a little bit of bleeding at the end of 6 months. So I was hospitalized, and the day I was hospitalized for a period of round about 15 days. And the day doctor told that yes, it is okay, you can go home and you just be on rest. That day only in the night I had labor pains, and it was a normal delivery. I had a labor pain for 24 hours and it was a normal delivery, and I delivered 2 female childs.
On an average, the fertilization rate in an IVF cycle would be around 70%. Similarly, embryo formation or embryo grading, which is done at 3 days post fertilization, would give you a percentage of around 30 to 35% cases where more than one good looking embryo has formed in every IVF cycle. Beta HCG or a clinical or a chemical pregnancy happens when the lady is tested 15 days after the embryo has been transferred, and we check her hormone levels to see if she is pregnant or not. A beta HCG level of more than 5 is taken as a pregnant positive test. That sense, a beta HCG positive comes out to be around 35% in women who are less than 34 years old and around 30% who are women more than 34 years old. At the age of 40 and above, that is lesser, that's around 20%. Unfortunately, even after the beta HCG comes out to be positive, around 25% women will undergo abortions, as a result of which a take-home baby rate, that is a live birth rate, which is when a baby is born finally following an IVF cycle, the success rate is around 25% for women who are less than 34 years old and 20% for women who are more than 34 years old.
Nowadays, most working women are putting off marriage till they are 30. At this age, their fertility declines fast. Also, professional stress and strain often result in premature menopause, which prevent them from conceiving normally. It is said that women lose around 2 eggs per hour. A woman at the age of 16 has about 400,000 eggs. But at the age of 46, there will be virtually none left. But medical advances have made possible for even women who have reached menopause to have children. It has been reported that scientists have found a protein which they believe could be developed into a pill or an injection to extend the life of women's ova. But the greatest concern over the IVF procedure has been whether it increases the risk for birth defects.
Initially, when IVF was propounded, people were thinking that it might give rise to a lot of unnaturally unhealthy babies. And there were a few reports also, but subsequently it was proved that these babies were more to do with the advanced age of the patients who were undergoing IVF rather than the procedure of IVF.
See, the kids are very good now. At the time of delivery, they were just, one was 700 grams, one was 735 grams. So, according to the doctors, we didn't have 1% even chances for the kids to survive. But still, they tried their best and God helped us. So, the kids are very well now.
One just cannot rely on technology and keep letting biology to work against individuals.
In effect, infertility affects around 15% of the population. So, there has to be some way we can prevent infertility rather than treat infertility. The way to go about doing this would be, the lady should be conscious of her irregular cycles. If she is having irregular delayed cycles, lot of hair follicles on her body, unnatural distribution of hair, family history of diabetes or obesity, she should start consulting doctor as soon as she is aware of this condition. That could be before marriage. This could stem from a condition which is known as polycystic ovarian syndrome, which if treated at the right time prevents infertility in future. Other reasons of infertility in females could be, as I discussed, pelvic inflammatory disease or tuberculosis. The only way to prevent all of these is to remain hygienic, stay away from dirty pond water, and to prevent and treat urinary infections as soon as they occur. If these simple techniques are taken care of, most of the women who are finding it difficult to conceive now would not do so. As regards to male factor infertility is concerned, we personally feel, we have felt this in our practice, that men who are exposed to high temperatures for long duration of their work hours tend to have lower sperm counts. Men who are addicted to smoking, coffee, cold drinks are having lower than usual counts. So, they should give up these addictions and make sure that they give a cold wash to their testes at least twice a day and stay away from heated environment as much as they can.
The people who don't have the complete knowledge what IVF is actually, they are like, lack of knowledge only will not let them go for this thing. But it is, I think if you're not able to conceive naturally, then you should go for IVF. One should not waste time.
There is no harm in going under an IVF. The babies are normal. No problem with the babies. It is just a normal procedure which is done artificially, and there is nothing else which is unnatural.
This is also a type of disease. This is not a taboo that you are not going to become mother or father. So one should not hesitate. They should go, and just because science is so much developing, they should at least get benefited with it.
This treatment is like not very expensive also.
Of course, technology can perform miracles, but there are pains before the miracle.